So you're just causing trauma, I think.
It's basically, you breathe in oxygen, you breathe out carbon dioxide. So the idea is you inject carbon dioxide to a localized area, and then, that's very tight, so you're very stuck. And then the body says, okay, I need to send oxygen there, and then with fresh oxygen, then healing can happen. I don't know why I did that. Ooh, the boobie just got hit. Okay, so how do I do like that? Okay. Is that tight, Carl? Are you breathing? Okay, so just to recap, we hold it like that when you insert it, or do you hold it here? Sorry, do you hold here or here? Is this supposed to be open?
No.
Okay.
So what I like to do is you can hold it like this.
Okay. Wait,
or you can,
sorry.
So hold it like this. Or hold it like this.
Okay.
Because you can have a little bit of play between the two.
Okay, I think
so. I find more control that
that's
way.
a great idea.
Okay,
So
yeah.
open the wings. Okay, well, I don't know if this thing is working, but we'll go for it anyway. That feels very deep. I don't see a flashback. So what do I do now? Angle, change it. I'm gonna try again. Sorry, Carl.
I think you need to go a bit deeper.
Deeper? Okay. Without the bubbles there, okay. No, I mean, that's a very high angle, I don't know. More deeper, maybe think. No, I don't think that goes.
You're stuck. Try a little down, yeah. I tried there already. It didn't work.
Can we try his broken arm?
You can do whatever one you want.
Okay, because this one, I'm gonna try one more time. But I don't know if the plastic's getting stuck now.
Ooh, we can do a new one.
Okay. Cannulation. Okay, that's very dead. That just slips right on his leg. Okay, no. Is the blood on? I'd like to blame the bag, but no. Okay. Oh wait, look, but I've got the Kool-Aid in there. Okay, we're not finding any blood there, but I think. But
So remember, we're going to look for the ligament, and then we're going to be on
Literally
laterally looking for that vessel.
Sorry.
Ew, ew, ew.
Sorry.
Ew. Oh my gosh. Ew.
Okay, well, I think I found his blood there. No?
I think something here. Yeah. Feel it?
Should we try? It's just because, everyone's... Let's see. I mean, what is the worst that can happen in this man? Look
yeah.
at you. You're so good.
Yeah.
Okay, so we've got blood. So now we're going to put this under. And we need to remove this, unscrew it, right?
Yeah.
Hold it. Remove this a little bit. See if there's a second flashback.
Yeah.
There is. Now what I do, I take this out.
And they put
So push and pull. So you're going to push with the blue. Push in as you're pulling the needle out. But before you do, see that little white... Oh, you got the white cap. Perfect. Yeah, I didn't see it in your hand. Sorry.
Okay.
So you're going to pull that out as you're pushing this in.
at the same time.
Yeah.
Oh my god.
Push and pull. There you go.
Okay.
But before you put the cap on,
Okay.
and then it should flow, and you want it to flow all the way to the end. Yeah.
So if not flow, that means it's
I don't know if I pushed it in. I didn't push it in all the way, or should I push it
No,
in?
that's fine. That's good enough.
Okay, but he's not bleeding now.
So sometimes what you can do is just pull out a little bit. Sometimes it'll get going again on an actual human being. But that's good. I'm happy with that. Carl's a bit fussy.
Okay, then that's in. Then we tape it down with micropore.
But I would clean this. I'd clean that area first.
And then I take this away.
Yeah, and maybe put like a thin piece of gauze underneath it. Now, when I tape, okay, so I'm a bit fussy.
It's good. We like.
You
fussy.
might have noticed.
I like it. It gives me structure.
So I like having everything prepared, but I need you to kind of get a feel for what we're doing, and then we can properly set up.
Okay.
I do it in small stages. I don't want you to be overwhelmed. Oh my god. This is like
Your
a
nails
thing.
are too pretty.
Oh god, now they're functionable. I couldn't do this with my natural nails. I grip them.
Oh really? Yeah. I'm not allowed for my job.
Yeah, pretty. say that's
it's
pretty
pretty
good.
much No, but specifically for feces, because I do colonic, so if I had to get something under the nail, I instantly could get parasites or something like that. So I have to have man hands. As soon as I can, on holiday 2 days, I'm like, stick on.
Yeah, no, I was just gonna say that would probably be the best option. Okay, so, alright, I don't like it this wide, so I'll take it. Yeah, and before, I'll actually put this on their kidney dish. Sorry, this is like a different room to what I was in yesterday. And so I feel like they've moved everything, hidden it on me.
Do you have iPhones?
Yes.
Okay. We can airdrop it, because this is going to be long.
Yeah, I'm taking photos of you guys today, so you can have it for your marketing.
Okay.
So if you see me come around and I'm like, put your head back,
Okay.
I'm just trying to make this thinner, I won't get your arms in it. I'll make sure there's plenty of space so you can put
I
logos.
should have put makeup on, sorry.
No, you can have a mask on.
At 5 o'clock in the morning, I was like, I can't care enough for this.
Alright, so I like to make a little tab.
Okay.
Yeah.
So pretty.
Well, the reason is this way when it comes time to take it off, or if you have to adjust it, you're not sitting there picking. You can just go tab. Yeah. So at this point, you've got a very nice clean dressing, and then change your gloves if you're probably going to have blood on it. So change your gloves, come back fresh, and then you're going to hook up. Now, the one other step I want to add into this, blood pressure. Okay.
Is it only one, not two, just to keep it in place? This is just for blood, right? Do we put this on before we do everything?
Yeah, you want to get that area nice and clean, have everything secured, change your gloves, start working on your bag, yeah?
Okay.
Before you put any of the vitamins in your bag, you want to go ahead and connect it, and you want to make sure that when you start letting that run, you want to make sure once it starts to run through your cannula, you're going to check it. Now, what can happen is, remember we talked about having the vessel that can blow. How you're going to tell is that they might experience a bit of discomfort and pain, doesn't feel nice. If you put your finger here, you should feel where at the back of your hand it's nice and cool, but you should also make sure that you don't feel a bulge of fluid. If you have that, it's called tissuing. And what that means is the fluid is now going in their arm as opposed to the vein. And nobody wants a liter or a half a liter.
I've had that to me before.
It's uncomfortable, yeah. So all you do is you stop the drip immediately. You remove your cannula. You obviously clean the area, and you just give it a nice good massage. Yeah. Now, remember, I was just saying about blood pressure. So before we even start, we want to make sure that we're actually taking their blood pressure.
So before start this?
Before, yeah, because we want them to be nice and calm. They've had a few minutes to sign their consultation form. You've had your conversation. You're going to figure out what they need. Obviously, they've already met with your prescriber, so they have their prescriptions ready. So you're going to do their blood pressure, yeah, before they get started. Once you have the cannula in, you've connected them to the bag. You've let it run. You've checked, yeah, that everything is working properly. You can go ahead and check their blood pressure again. As it's kind of coming through, you can start adding your vitamins in, yeah. And then you're going to check it one more time. So first is a baseline, and you're going to write it on your consultation form. The second time is going to be about here, yeah. And the third time is just about here.
So what do you mean the baseline is where?
In the beginning, before you start anything.
So you need to keep checking at intervals. Okay.
Yeah. So 3 times. Once you first started, second time about here, and then third's about kind of here, about more than halfway, 3/4 of the way through. And if it's on a smaller back, just kind of figure out when they're almost towards the end, yeah? Just because you want to make sure that their blood pressure isn't going up.
Okay, so ideally blood pressure 2 to 3 times in the treatment. Okay.
Or
if
if
it the blood pressure before.
it's okay, sure.
Yeah, the lady who gave me Educator, she's got a really cool one. It's like a watch. She puts it on here and it goes. And you don't like it? No. It's like a hand one.
Yeah, I have it with my watch,
Yeah.
but I'm just used to these.
Yeah, old
So-
school.
Okay.
Wheel ain't broke, don't fix it. Okay.
So the other thing too is we want to make sure that their blood pressure isn't going too low. Yeah. So this treatment isn't going to be for someone who has any kind of health issues, heart, liver, lung, kidney disease, but that's everything that we do anyway. We're not going to treat anyone. We're not going to do any type of these health and wellness treatments on them if they're not fitting well already. So if they already have high blood pressure, that's an indication they may not be able to, because this can actually raise their pressure.
Okay. Even though it's medicated, I have someone in my mind.
Well managed, but you probably need to discuss it with your prescriber.
Okay.
See how comfortable they are issuing you a prescription for IV.
Okay, so it will be a prescription client by client basis. Okay, because I just saw my lady has like a whole bag of goodies and she just, I don't know how many people she does it with, but I realize now the amino acids are all non-prescription. She gave me taurine and I don't know, leucine or something like that. Yeah. Okay. So it's going to be expensive in a sense because you're adding on a...
Well, the IV bags themselves, the same line as prescription.
Okay.
So she still should be working with a prescriber.
Okay, so you can't order like 10 bags in one go and then... Okay. Alright.
But each prescription, each item purchased for that client is supposed to be going and used on that.
Alright, okay. Yeah, okay.
Right, so blood pressure. This is how we're going to do it. Okay. So, obviously do it on the arm, but we're not doing the IV one. Okay. We want this arrow to be in line with
The vein. Okay.
so proud of these.
Very good.
So that's not gonna. Oops, sorry. That's not gonna cut it.
It needs to be tight as well. And I learned now you get different sizes as well. There's not one standard size. So if you have extra large ones, you have to really get extra large ones as well.
Okay.
Does this one speak to you?
No.
Let's start to understand. We get ones that will tell you your data is 120 over the you are healthy or something like that.
Oh,
Right. So this is gonna show you the ranges.
So
ideally,
is high.
Ideally, they need to be laid down, not talking, and not having their legs crossed.
That's pretty good.
So which one is the average one?
You have to look at both.
So normally it's 120 over 80, but that can be different, male or female, heavy, not heavy, medicated, unmedicated. Mine's actually high for someone else, but not for me because I have high blood pressure.
I was just thinking you were talking.
No, I'm just
90 over 60 is bad. Right.
It'll tell you in this range where you're at.
So the regular is the under, yeah.
Yes, so I'm right down here.
Okay. Oh.
Right, so you'll get practice on this today. It's not intimidating. It's only intimidating when a nurse points out that you put it on upside down.
Oh yeah, you're like.
I was like, I meant to do that. I was just testing you. Right, so.
Okay, so
How you feeling?
back to that. Okay, and then we're gonna stab that in the blue one. Get out all the air, but can we do it? Practice bag, okay. So I don't have to do anything. So this now is all clean. I'll take this off. This stays on throughout the IV.
Yeah.
Okay, because when we remove it at the end, it can bleed because I have bled a lot and she didn't. Yeah. Okay, I've seen it. Okay, so I understand.
So we can use a sterile drape. Kind of cover them. We want to make sure the arm is kind of sitting flat. Some people, they start talking, they grab their phone, and that arm starts to sneakily bend. You're gonna be there all day. Anyway, pop it in. So we're not actually going to put any in poor Carl, because I'll get yelled at if his blood's watered down.
So I would make sure this is switched off, which is
Yeah.
closed. I don't know how much.
It only takes a couple of times for you to learn your lesson when you mop up the floor or you start sliding on it because it's dripped all the way through.
I don't know. I just went. Is
Yeah,
is
that's
there
it. Keep
like
going.
it doesn't matter how deep or heavy? Or...
I just make sure, so this part right here, that opening, it needs to be in the actual fluid, so high enough up,
Okay, so it
So if you have to get the bag started, you can squeeze that and just get a bit of, you need to have some fluid in here.
Okay. Ooh, squishy.
Right?
Okay.
But don't fill it more than halfway because you still need to see
The drip.
Yeah.
Okay.
So grab you can use your kidney dish or you can use your sharp spoon, it's whatever you want. You can use a sink if you're closer to your sink.
It's just easier to use this because then you don't have to clean the kidney dish. Okay.
And it's saline, so it can go right down the sink too.
And then what is, like, so I see the speed of this. So I've always wanted to know, what is the speed you want to work at all? That's...
Well, remember we were talking about drip rate. So a liter bag you would probably use in a hospital setting over the point of, over the time frame of 8 hours. We're not working on an 8-hour time scale. So what I would say is that you would have it go in as, first off, we're going to go about half speed. I'll show you what half speed is. Okay, so half speed is here.
Right. That was quite fast.
It is fast because there's no pressure holding it back. So
okay, should I give some pressure?
Yeah. See how that slows down? Yeah.
Okay.
So half speed, when we're looking at it, if it's in a person, is here.
Yeah, because that's, I think mine was a bit slower than that.
So typically, what it looks like when we start out, let me see.
I start to understand now. About
Right, so that's about half speed. Yeah.
Yeah, that's good.
Yeah.
So that's where we want to start at.
And then check your blood pressure. Yeah. And then you put your vitamins in, and then as it starts to, as they start to settle in and you know that everything is in place, then you can increase the speed. If they start to feel like there's a lot of pressure in their hand, because their hand's down, and you've got a lot of fluid that's going to go in, you can, or it's uncomfortable, you can slow it down a little bit.
Okay, yeah.
So we need to check the blood pressure three
times.
Okay.
So in the very beginning, then so we know what their blood pressure is normally. Then we're gonna start the drip, then we're gonna check it again just to see if it's gone up a little bit. And then we're gonna check it about half, 3/4 of the way through, just to make sure that it's not gone any higher. If they start to complain of being like dizzy, or they've got a headache, or they don't feel well, stop the drip, check their blood pressure, and you might have to call it as the end of the treatment.
Okay. Can I ask, when my last one I had, my whole arm went like ice.
Yeah. So remember I was saying when it's nice to put it on radiator, get it warm.
Okay, because we're friends, so she was like, "Oh, okay, I'm gonna stop the treatment," and I was like, "No, it's fine. I don't feel funny in my head. It just feels very cold."
Yeah, because it's cold.
Yeah, but she panicked, so maybe she didn't know about it.
I mean, there's a difference in temperature between
Yeah.
my body and this IV bag.
Okay.
So the trick is warm it up before they get in there.
Okay, I'll tell her that actually. I think she'll take that.
So the blood pressure always has to be the other arm, not the
Of course,
arm.
yeah.
Not in the cannulation.
Because that machine goes.
Okay.
Otherwise, I think you'll be spitting blood in here. No, I'm joking. Not true. Okay, do you want to try?
Let me try this first for me to see the flashback. Okay.
Find the right hole.
I'm going to copy that.
Okay, this is not as. I was a bit worried about like phlebotomy. I haven't done it in a long time, but it doesn't feel strange. Right. And I did
Like
it.
riding a bicycle.
Yeah.
So I first trained it. So James and Joe were the owners. James taught all of the nurses in the Northwest how to do IV. And so I did his class, and I had the absolute terrifying experience of having to cannulate James as a student. I didn't work for him then. And he's like, "Oh my God, it's James." And so he's like, "Oh," because he doesn't like it, so he's like this. And so I was panicking. I'm like, "Oh my God." And I got it in, it was fine, it was totally fine.
Okay.
But I didn't do anything with it for over a year. Like not one. And I'm like, "Oh my God."
Okay.
And
what I'm
you
doing
can
now,
lose it.
guys.
Oh, good for you.
Okay, so this.
Okay.
So the trick is to just keep practicing. Even if it's just if you've got a family member and they pay for the costs, grab your little white. Do you think?
Yeah, my boyfriend.
Make sure that blood comes all the way to the tip.
Mm-hmm.
Yeah, go ahead. That's fine.
Okay.
Yeah, you can-
So, do I put the plastic in all the way?
That's fine. That's fine. Oop, sorry.
I don't know what to use.
You don't have to put the plastic in all the way.
Okay. It may feel uncomfortable for the patient.
I mean, this is plastic. I think it's okay.
Okay. Okay. So all.
It's gonna be messy. It's gonna be messy.
Mm-hmm.
But we're not gonna take this down if it's messy.
And we'll get a new one.
Yeah. Okay.
Yeah. Because this is a spa treatment.
Yeah.
This is not an accident in the emergency room amputation. Okay?
The best part is they were like the people I'll treat will be like they have no idea.
They're like,
Just-
oh my god,
we
this
love the
blood
blood.
and shit. Fabulous.
That's all we want to see the blood. Get excited with the blood.
Yeah, the problem is oh careful, if you've got that, you don't wanna yeah,
Yeah, your hair would be abnormally anyways.
Okay.
Yeah.
It's a real blood, is that?
No, it's
It's not real blood,
juice.
is
Juice.
Juice?
but it stains.
It's a stain.
It stains.
Yeah.
It took me about 16,000 washes to get it out of my white shoes.
Oh
so.
dear.
White shoe. No. I don't like
It looked well. So Lorraine, our prescriber, we carried Carl from one room to the other, and I was like, oh, and all of a sudden I started to slide, and I looked back, and it was like a murder scene.
Oh,
like
no.
we had legitimately chopped somebody's arm off and dragged it through, and we were laughing hysterically. And I'm trying to stand upright because it's all over. It's all over. And I was like, if we ever had to bury a body, I said we would get so busted because we just left a ton of evidence.
Nothing to see.
Just nothing blood.
I think your fingers got
Oh,
it.
sorry. I'm going to.
You usually hold the butterfly like this or
I
not
think
like
so.
that. Is it like
Is it
this?
flat or I think up
Up
Is it?
here. Is it like this?
the wings? Yeah, I think so. That's how I remember it from so many years ago. Okay, do you see a flashback? You don't chuck the whole needle
Do I
in
have
at
to
the
check the flashback? Like I have to pull this out?
So there's a
No.
flashback here,
No.
and then as you pull back,
Mhm.
you'll see a secondary flashback.
Okay.
And then as you see that, you'll push that forward. So instead of holding it like that, we're going to bend the wings down, and you're going to use this as like a little guide. So this is one tab, that's the other tab, and you're going to split it.
When you first inserted, do you hold the wings up?
No.
No?
Okay.
No, because remember I bent them.
So you just
I bend them flat.
Yeah. So you
This
just
way
hold
I'm
the
already
blue
in position. Yeah,
Okay.
just the cap.
Okay.
Is it flat like that?
I think hold. I'm thinking to hold like that on this thing. That's what I think. But don't ask me. But that's funny because that's what courses are like. They're always like, you can make £300 from a treatment twice a year.
Sclerotherapy got me like,
Oh.
Yeah, I don't know that one. What is that?
it's thread band
But I can some tissue. It's going down.
Oh, you sweating?
Yeah.
Maybe just use Catrol, no?
Oh, here you go. You can use this. You can use some gauze.
I'd just like to end off this video with sending a very big thank you for taking the time out to watch this video, and I really hope it has helped you in a specific way, whether that's relaxation, education, awareness, or just really helping bring some calmness and stillness to the mind. And on that note, as this video ends, please can I ask if you can like and subscribe or even comment on how you felt about this video, and if it helped you or if you learned something from it. And I'm sending you lots of love wherever you are in the world, and inviting you to come back next week for another video. This is Star Friedenberg, empowering your mind and body through wellness consciously.